Hello, ladies. That was kind of weird. Thought I had turned my video on. Welcome. Welcome to Wellness Wednesday. Hope you all are doing great. And I just want to make sure everybody can hear and see me all right. Okay. If you can give me some thumbs up, that would be wonderful. Looks like, okay. Looks like we are good. We're going to talk some more about about gut health tonight. Before I get into that, though, while we let any other ladies that want to join do that, I will say my disclaimer. Please remember that anything that I say tonight is just health information and is not health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do that, please first consult with your prescribing practitioner so they can help you do so safely. And by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. All right. See a lot of people on here tonight wanting to know about gut health. Hello, Bobby, Jen, Joyce. Awesome. Thanks for joining us. And it's impossible to cover everything about the gut, about how we need to address the health of our intestines, because this is such an important piece of getting and staying healthy. It's really where if you can kind of imagine, it's like other than what we breathe in, it's the first interface between what we put into our bodies by way of eating and drinking. All right. So obviously that initial exposure is impactful. And our bodies do a great job. Our immune systems do a wonderful job of nipping things right in the bud before they really become problematic until the intestines and the immune system get so overwhelmed by different things, and we'll get into a couple of those things, that it just can't really keep up. It can't do it. And when we have other toxicities, um, I talk a lot about mold mycotoxicity. When a body has a lot of toxic molds and, well, we'll call them mycotoxins, like they are called, but when we have all these different toxins, heavy metals, then the immune system has to fight even harder. And this is when we start to develop things like food sensitivities. Parasites are also a factor there because we're all born with parasites. And I've done a wellness Wednesdays on parasites, and you would do well to go back, and because that is another potential gut topic, certainly, but they don't always stay in your gut. That's the important thing. They migrate away from your gut into your cells and tissues. And so they have toxic byproducts, right? Their wastes become toxins. Okay. One of them is ammonia. All right. Ammonia, which is, you ladies might know it as something you use to clean with, right? It's in cleaners and things like this. Well, parasites produce that. And our bodies do have a way, our cells have a way of dealing with it. And it starts there in the gut. But again, when these are now migrating from the gut into our tissues, then that's a whole different ballgame, right? All right. So I wanted to focus a little more tonight on a couple of good gut issues. And actually, if she's on here tonight or not, I don't know. But Sandy suggested that maybe I talk about biofilms. And that actually is a really good thing, topic, gut health topic, because it's something that so many of us deal with. All right, so let me start though first with food sensitivities. Now, the difference between there is a difference between an allergy and a food sensitivity. All right. You can have a food allergy, which can cause some pretty severe symptoms like swelling and where you can't breathe, called anaphylaxis, um, can really ramp up the histamine response, right? So that's different, whole different topic, but that's an allergy and it happens almost immediately. Okay. Whereas food sensitivities can can cause some more immediate symptoms, but they can often cause delayed reactions. All right. And food sensitivities uh, are when you'll eat something, all right, and then your immune system will respond. And because the immune system right there, and it often has to do with leaky gut, that's almost always involved, um, and is part of the underlying process of developing food sensitivities. These undigested foods or partially digested foods, food particles will go leak into the bloodstream from the intestines, and then your immune system's right there in what we call, and I talked about this last week, the gastrointestinal associated lymphatic tissue that will make antibodies against that certain food. Or it may not necessarily be an antibody. That happens after, more prolonged exposure typically. It just may cause um, symptoms, unwanted adverse symptoms. Okay, like I would I would get headaches if I were to eat certain foods, and so I learned not to eat those foods because I didn't like having the headaches, and and so that was something I don't necessarily have antibodies that my immune system's making against that food, um, but that is something that happens as well with prolonged exposure. All right, so food sensitivities. I just said that the immune system then responds. Well, this means that food sensitivities are triggers for autoimmune disease, triggers causing and perpetuating autoimmune disease. All right. And one of the major ones we've found with Hashimoto's is gluten sensitivity. Um, but you can be sensitive to anything. This is why I can't just give you like a everybody the same diet. I can't just put this out there in the group and say this is exactly what you've got to eat, because I don't know if you're sensitive to some of the foods that would be healthy, but maybe they're not for you. Uh, several of you individual ladies know you react to different foods. Some of you react to nightshades. Some of you for sure, react to gluten. Some of you react to dairy. Some of you don't react to those things, but they still cause problems. They still cause inflammation. All right. So healthy foods that you react to, this is usually because there's an underlying problem, and generally it's toxins. All right. So food sensitivities often are caused because you are harboring, especially mycotoxins, mold toxins. Um, but bacteria produce toxins, right? Um, bacteria produce certain bacteria produce biofilms. All right. We're going to talk about biofilms now. So, food sensitivities, I think I've covered what I want to cover there. I do talk about the food sensitivities in the master class. Always get questions on that, so always address that. But let's talk about biofilm. Biofilms are sort of this. Uh, it's a mucousy, uh, kind of The technical term is an extracellular matrix. All right. Often mucousy, slimy, which protects the organism that made it from, antibiotics, immune response, right? Environmental stressors in order to survive. All right. The key is survival. And so you have some of these, uh, these bacteria, yeast, um, are known to produce biofilms, um, and other fungus, yeast and fungus. Then we have different parasites that will produce them as well. All right, protozoan, and so forth. So let's again kind of define where this biofilm happens. Certainly, it's a biofilm you're probably familiar with is plaque on your teeth. So um, you have these plaques, and this is basically a biofilm produced by the bacteria, all right, that live in your mouth. So, okay, what is the purpose of that? Well, it's to protect it and it's to help it to thrive. Doesn't mean it's doing you any good. And one place where we tend to collect a lot of biofilm is in the gut. All right, that is, and so certain bacteria, I'm just going to name a few here that that you may be familiar with, especially some of you patients who have had your stool testing done. Um, Pseudomonas makes biofilms. Klebsiella pneumonia, which often we find in the gut. Again, it shouldn't be there, but it's there. Um, E. coli. All right. These can form biofilms in the urinary tract as well. Right. So, and in the gut. Let's see, certain staph bacteria, especially, MRSA, um, and MARCoNS, multiple antibiotic resistant coagulase negative staph. That's a mouthful, but that is one that produces pretty hefty biofilms and generally collonates up in your nasal cavities, so not necessarily in your gut. But let's think about why this would be important, in why would it be an important thing to treat in the gut or to to help with? And it's because these biofilms cover your lining. Say, I kind of described leaky gut last week at in Wellness Wednesday, like this patchwork quilt, right? Where the patches, the quilt patches, held together by stitches, usually those stitches had broken apart, and they now have this gap, between the patches of the quilt, and so the lining, right, of your intestines inside, and then things can leak through those holes, those openings. So biofilms can also cover and prevent absorption in your intestines. So they can cover the linings of your intestines inside and prevent absorption of nutrients, right? And then it also, again, protects these organisms that are not good for us, and they can continue to produce toxins. Okay, so that's exactly what MARCoNS does up here. That's what Klebsiella can do. That's what E. coli can do. They can produce these toxins that cause more and more inflammation in your body and trigger an active autoimmune problem to really flare up, right? Or in other words, these toxins cause the immune system to attack, say, the thyroid in the case of Hashimoto's. So, sorry, I was looking at a text with a question, and I will take a few questions, answer some of these questions. I believe Emmy is helping with that, so thank you. So we'll get to some of those questions after this, before I end. So bacteria, Candida. Let's talk about yeast that produce biofilms. So Candida can produce these biofilms. Let me go back. Some of you might have heard of Salmonella, right? Those produce biofilms. Enterococcus might have been seen on some of your gut, your stool test results, those of you patients who are watching. Um, let's see what else. Uh, H. pylori. Okay, H. pylori can produce biofilms in the stomach as well. Okay, so I mentioned Candida, albicans, Aspergillus, certain molds, certain Aspergillus molds. I mentioned certain parasites, so protozoans, and and it's really important that we understand what the consequences are of having these biofilms in our bodies are. Excuse me, got a, a tickle or something. So the biofilms protect these organisms, but it covers tissue, right? It blocks absorption, um, and it blocks functioning. All right. So uh, the problem is that they're difficult to get rid of. Biofilms are fairly difficult to get rid of, and medicines don't really help with this. All right. So some of you may deal with chronic sinus infections, and you've been given antibiotic after antibiotic to treat a sinus infection it just doesn't go away because you've got a bacteria in your nasal cavities and your sinuses that are protected by these biofilms and have other mechanisms as well to promote antibiotic resistance. But it's these biofilms that must be done away with, right? We've got to get rid of them. And so that's part of our customized care plans for patients because, invariably we'll see that I mean, there's really not a good test for them. But when we know there's certain bacteria coming out in the stool test, we know that there's going to be biofilms that they're dealing with. All right. So you got to deal with that correctly. And again, medicine isn't going to really help. So uh, these protective mucousy matrix kind of, it's this stuff, right? And so I have patients all the time letting us know that they're passing things. They're passing stringy things, which we would definitely think of as parasites. And so, well, could some of that be biofilm that you're passing? Well, it could be, but what happens is these biofilms also protect these parasites. And so they're enveloped in these biofilms as well. All right. And so we love to hear that they're coming out, right? We love to hear that this material, this extracellular, extra meaning not part of your tissues, but on top of your tissues, is coming out. And I'm gonna pick on her and tell her to tell on Sandy who asked this question, wanted me to address this. Then she's finding that she's losing some more weight after releasing some of these whatever they are, because they could be parasites, they could be biofilms, could be both, and it's just better out than in. I guess that's the best way to say it. They're just better out than in. So, all right. So I'm gonna as far as biofilms go, there are agents that we can give that stick and pull on these things. Okay. Literally, it's like, I know this sounds kind of gruesome, but maybe pulling like a scab off a wound. But it's not quite so bad. It's not painful necessarily. So, um, and so it pulls these biofilms out, and we can get rid of them when our bowels are moving properly. And that is also something that some of you struggle with. So let's talk a little bit about constipation. So it is typical I should say it's normal for us to have a bowel movement after every meal we eat because eating a meal stimulates our bowels to move, stimulates the small intestines to do their thing, stimulates, first of all, the esophagus and stomach to do its kind of peristalsis activity to move food along, move it down, move it through. And then it's, then it's a matter of pulling enough water out or leaving enough water in the colon to where you can have an adequate bowel movement, like I said, up to 3 times a day. That's normal. That's desirable because that's going to help you get rid of toxins as they're moved from the cells, the tissues and organs down through the lymphatics, through the liver and bile system into your intestines with the bile, right? So that you can excrete these toxins. This is the best way to detox. You don't want to push detox too fast. If you're not going to the bathroom as often as you need to, then you don't want to push this as fast. Otherwise, then you start to stress the kidneys a little more, start to get skin reactions, start to get maybe allergies, mucus production, start to get even maybe breathing issues, asthma, allergies, and I'm sorry, asthma, or some sort of reactive process, some sort of reactive airway process. So this is so important to understand um, what the normal should be. And that does mean you have to, drink enough water throughout the day. That helps. It does mean that you can be active and should be active because that helps promote better peristalsis through the colon. Um, so that's a little bit about constipation. Now, some of you have been dealing with this for years and years, and I'll tell you, it's usually because of insulin resistance and hypothyroidism. All right, that's why you tend to have this constipation problem. Um, it could be nerves too. Some of you who are still in fight or flight, you're not going to stop to poop when you're running from a tiger. And when that's all you're doing is running from that tiger, you're not going to stop and poop. Right? So that's the good, bad, and the ugly about that. All right, let me see what questions. I know, like I said, Emmy had seen a few questions, so let me pull those out. Bobby asks, is bromelain a good supplement source for biofilm? So I'm assuming that you're asking about removing biofilm. Bromelain probably won't remove it as well as other things we use. There are definitely other more helpful binders. One of the things we do with the Marcons to break up the biofilm there is use EDTA. All right, that's one helpful thing. But we use other things with our customized care plans to pull those biofilms off. Yvonne asks, is thyroid the cause that I can't swallow to the point that it hurts? Well, so this isn't necessarily a gut related question. I'm going to try to answer those first, but since I took that one, let's kind of go there. It certainly can be because if your thyroid is swollen or if there are nodules, if there's Hashimoto's, that can certainly make it difficult to swallow and painful to swallow because there's no room. And so that's something that definitely needs to be checked out. Generally needing ultrasound at least to characterize what's going on with your swallowing. Hazel, hello there. Glad to see you here as well. Is that the slime that is on the bowel movement? Sometimes you see a little bit of that mucousy stuff slimy stuff on your BM. So yes, that can be, or it just can be coming out on its own. Um, Vivi asks, does the diet help keep biofilm from reforming down the road? Um, well, what helps keep biofilm from forming down the road is eliminating those organisms that make those biofilms. It's not diet. You can't necessarily do this with diet. You have to be able to find out what organisms there are with proper testing and then go after those organisms that should not be in your gut, like those bacteria I mentioned, the Klebsiella and the Enterobacter, the E. coli. While they're a lot, they're common. Should they really be in there? No, they really shouldn't be. So that's the key. That's the way to prevent them reforming down the road is by taking care of the root causes of those biofilms, getting rid of any candida. A lot of you have candida overgrowth. We see that in stool testing. Parasites. You all have parasites. We all do. Okay. Um, and so many have blastocystis and other protozoas that you didn't realize from maybe, swimming in lakes when you were younger, creeks, whatever. I mean, you can get them in here. Okay. Marie asks, raw vegetables versus cooked, and then why? Not sure what the why is for, but uh, I think it's good to have a variety. You don't need to cook all your vegetables, but you certainly don't need to eat them all raw. I think it's good when you do have trouble digesting. If you know you have trouble digesting, then that would be uh, why you might cook your vegetables some. And they don't have to be cooked to death. They should not be cooked to death. They need to be just lightly steamed or roasted or sauteed and not super cooked through, right? Um, Margarita asks, what happens after you identify the organisms? Well, when it comes time, if you're in your customized plan, right, then you will be you'll receive the right treatment for those organisms. And sometimes that's natural antibiotics, lots of herbs and things that will get rid of, you know, those types of bacteria and those yeast um, enough that they can be balanced, right? Or if not, just gotten rid of completely. And then you definitely have to rebuild. You have to rebuild with the right bacteria and get the right bacteria in your intestines. That's what we call a healthy microbiome. Lisa asks, what would cause a twisted esophagus? Um, in our bodies, we have connective tissue. It's called fascia. And this is certainly not a common thing to have happen is a twisted esophagus, but it can, and I've heard of it, um, where you have structural misalignments in your spine that can certainly cause a pull on a different pulling on the connective tissue that also can pull on the esophagus. So we're talking about like your thoracic, mid upper back spine, part of your spine. And that's why it's a really good idea to get good chiropractic adjustments, um, regularly to stay aligned. Um, if you have certainly really bad, and it's going to be bad reflux disease, could cause a twisted esophagus because the undigested food that sloshes back up through your esophagus can cause irritation and spasming. So spasming of the muscles that are in your esophagus that are doing this peristalsis thing, this movement, wave-like movement to push the food down. It can seize up and twist, kind of a thing. Again, I don't think this happens very often, but it certainly can happen. And let's see, Donna asks, what if you suffer from diverticulitis? So another intestinal malady, right? For those of you who don't know what that is, it's weakening of the colon in certain areas where because of then pressure causes it's almost like a balloon coming out of tissue coming out of the intestinal the colon itself, forming these pockets. So it's this balloon comes out of the and forms um, on the outside from the inside out of the colon. And so this creates a pocket, right, where foods and seeds and different things can get caught, and you can develop, bacterial infections in those diverticuli, those little pouches, I guess. And so those, if though that is caused by constipation, by overstraining, um, and it's usually that it happens over time, over a pretty long period of time. So if you know that you've had an issue for a while with that and with the constipation, that could be a potential consequence, the diverticulitis. Miriam asks, if it's Hashimoto's interfering with swallowing, how is it confirmed? Um, so she says, I've been to an ENT and he recommended I go to a speech therapist. That's She gave me throat exercises to do. I've also been to an endocrinologist. He didn't mention connection to throat issue. I just think that's very incomplete. I'm sorry that you're not getting the attention that you need to with this. At the very least, the thyroid needs to be ultrasounded, and you may need further imaging to characterize if there's a mass effect, meaning something pushing swelling like a nodule and pushing back on the, on your, esophagus where the oral pharynx where you're trying to swallow. So, and the epiglottis. Um, yeah, I'm, I don't know what to really tell you. I don't know why they're not able to find why that's not an issue. Well, and they're not going to test for Hashimoto's because let me back up. Thyroid nodules are most often caused by Hashimoto's, and they're not going to really ever. I shouldn't say that. They're infrequently going to test for Hashimoto's because it doesn't change what they do. It doesn't change if they're going to give you thyroid medication or not. It doesn't change that. They're going to do it if they're going to do it if your labs show that you need it. So it's frustrating. It is frustrating when they're not really doing everything that they can to figure out what is causing that swallowing issue. So it's possible that doing certain throat exercises might help a little bit, but it's not going to solve the underlying problem. And if you have silent reflux as well, like again, it's not stomach acid, it's undigested food and acid forming from that, in the stomach, and it gets pushed up, sloshes around, it gets pushed up because it's not digesting very well, and you're not moving it through as fast as you probably need to. It's sloshing and coming up, especially while you're sleeping, and it's irritating and causing swelling of your oropharynx. And so when an ENT looks down there, and they do have the tools, the cameras to go down and look at your throat, if they're not seeing what they perceive as a huge inflammatory problem, even if they do see it, they can't do anything about it. And they'll have you take acid blockers, but that honestly rarely helps. So it's kind of lazy and incomplete healthcare is what's going on. All right. Sean asks, and I got some questions. Now, I do see a question about hair loss. I probably won't get to that today. We're gonna I talk a lot about hair loss and other low thyroid symptoms in the master class. We are going to be announcing the next one fairly soon because we're nailing down when we're doing it. But that's probably something I'll have to wait on answering. Um, Sean asks, I'm eating properly, but my BMs are all really very soft stools. Is this normal? Not firm, but more on the mushy side. It really depends on where you're at in your process. If this is Sean, hello, who is going through if you're going through your customized care plan and um, you're also taking care of other issues, right? You're detoxing and you're taking these other, certain supplements that could also be contributing to the looseness and the mushiness. Honestly, I'd rather it be that way than you not going at all. It's like it's getting it out. Better out than in, right? So always remember that. That's always the kind of the goal is to get these toxins out. And then this is the last question I'll handle. And Betseda asks, what about excessive scar tissue surrounding the colon or the inner walls? Um, First of all, I don't know why you would have excessive scar tissue unless you had procedures like endometriosis that was removed surgically, where you would get scarring that's pulling on the colon. That's a problem. That could be very problematic. Um, and and it's a different problem entirely. It's not a colon problem then, right? It's a scarring problem within the abdomen because of something, some other procedures or other things that have taken place to cause the scarring in the first place. So it's not a colon issue per se, right? But it certainly can cause problems for colon functioning. That's this. It's a symptom, right? Wow, you ladies have a lot of great questions, and I'm grateful that I can answer, a lot of your questions. I'm here for you for that. Um, I want you to have the right information. I want you to be able to know what you need to know to be empowered to make meaningful and lasting change in your lives. So a lot of these things again come back to, well, what are we seeing in your tests? What tests are you getting? Are you getting comprehensive testing? And then if you become a patient after getting comprehensive testing, then you're going to be able to have the treatment that you need as we have figured out your root causes, that we've figured out what your immune system triggers are and what's causing your symptoms. Because as we work on those things, then you'll have much greater chance of fixing these gut issues because we definitely have to focus there, and we do. So that's I'll leave it there. Any other questions that you might have, I'll probably have to get to in the comment section. But it's a pleasure being with you, ladies, again tonight for Wellness Wednesday. Remember, have hope. There are answers, and you still have the power to heal. So we'll see you real soon. Take care.